Okay, this guy is Professor Thomas Seyfried, PhD from Boston University, who's become very famous for two things. His research on the metabolic theory of cancer, and I think he did a great job with that. But he's also become quite famous for recommending the ketogenic diet for treatment of cancer. I personally think that is misguided. There's problems with the ketogenic diet. By the way, I'm going to have a link to Dr. Seyfried's video where he's saying that we shouldn't be biopsying cancer so much. He's actually claiming that biopsy of cancer spreads cancer. Quite often it should not be done, in his opinion. Again, I'll have the link to the video in the description below. Okay, so I think the problem with the ketogenic diet is you run into problems like the reverse Warburg effect, where cancer can feed on ketone bodies. I have made a video about that. It's from the Lasante paper. He's also outspoken. He says that chemotherapy and radiation therapy are medieval treatments for cancer. And again, that's a pretty strong statement. He's been slandered by Wikipedia, which actually, might mean that he's onto something, because Wikipedia, they always slander anybody who does anything good, like they slandered Dr. McDougall very severely. So anyways, I will have the link to him saying that we should not biopsy cancer so much. And of course, to biopsy a tumor, it really depends on the situation. There's a lot of nuance to all this. For example, if a radiologist sees a 2-centimeter mass on a chest CT in the lung, they can confidently say that is lung cancer. They can't subtype it though. They don't know if it's an adenocarcinoma, squamous cell carcinoma, etc. And sometimes that could be, or a small cell carcinoma, that could be highly relevant to guide the patient's treatment. There's other situations where maybe, you got an elevated PSA, you could simply go low-fat vegan and do, sort of a severe version of the Ornish diet if you wanted to. Ornish would tell you his paper was based on low-grade prostate cancers. How do you know if that's not a high-grade prostate cancer? So there are a lot of variables and nuance to all this, but it's still rather striking that a world-famous cancer researcher is saying we should not biopsy cancer that often. Trust me, that's a big deal, that statement, because the entire system, standard of care, is based on that biopsy. So anyways, I'll have the link in the description below.